In this video, we will discuss about the arcuate fibers in neuroanatomy or in the medulla oblongata. Now, there are three types of arcuate fibers. These are the internal arcuate fibers, anterior external arcuate fibers, and posterior external arcuate fibers. Now, we will discuss these arcuate fibers one by one. So first of all, we will discuss about the internal arcuate fibers. Now here you can see this one is the transverse section of the medulla oblongata at the level of medial lemniscus or at the level of sensory decussation. Now here you can see this one is the nucleus gracilis and this one is the nucleus cuneatus. And here you can see these fibers are coming from the fasciculus gracilis and fasciculus cuneatus. These are the fibers of fasciculus gracilis and these are the fibers of fasciculus cuneatus. Basically, fasciculus gracilis and fasciculus cuneatus are the first order neurons. These neurons relay in these nucleus gracilis and nucleus cuneatus. Now, from the nucleus gracilis and nucleus cuneatus, second order neurons start, and axons of these neurons, these are the axons. These axons or fibers are known as internal arcuate fibers. Now these internal arcuate fibers, they will run anteriorly and laterally around the central gray matter. This one is the central gray matter, and then they will turn medially. And when they will turn medially, these fibers will decussate. Means right fibers goes towards left and left fibers goes towards right, and they will make the medial lemniscus. So it means that origin of these internal arcuate fibers is from the nucleus gracilis and nucleus cuneatus, and termination of these internal arcuate fibers is medial lemniscus. Then always remember that which type of sensations these internal arcuate fibers carries. They carry the proprioceptive sensations of discriminative touch, pressure sense, and conscious muscle joint sensations from the same side of the body. Then next we will discuss about the anterior external arcuate fibers. Now first of all, see that these are the different cross sections or transverse sections. This one is the transverse section of spinal cord. This one is the transverse section of the medulla at the level of sensory decussation, and this one is the transverse section of medulla at the level of olives. And transverse section at the level of olives. Here you can see these are the two pyramids. Now in front of these two pyramids, these are the arcuate nuclei. This one and this one is the arcuate nucleus. Now always remember that these arcuate nuclei are the inferiorly displaced pontine nuclei. Now always remember that the fibers that arises from these arcuate nuclei, they will run laterally, cross the anterolateral surface of the medulla oblongata, and they will enter into the cerebellum through this inferior cerebellar peduncle. And when these fibers go into the cerebellum, they will make the circumolivary bundle. So anterior external arcuate fibers arises from the arcuate nuclei and their termination is into the cerebellum. Now, what is the function of anterior external arcuate fibers? These fibers play a role in relaying sensory information to cerebellum, which is crucial for coordinated movement and balance. Then after that, we will discuss about the posterior external arcuate fibers. Now here you can see these are the posterior external arcuate fibers, and this one is the transverse section of the medulla at the level of sensory decussation. Now this one is the nucleus gracilis and this one is the nucleus cuneatus. Now dorsolateral to the nucleus cuneatus, this nucleus is the accessory cuneate nucleus. Now always remember that fibers that arises from this accessory cuneate nucleus, these fibers are known as posterior external arcuate fibers. Now these posterior external arcuate fibers, they will go as cunocerebellar tract into the cerebellum and they will pass through this inferior cerebellar peduncle. So always remember that posterior external arcuate fibers arises from accessory cuneate nucleus. They will terminate into the cerebellum, and which type of sensations they carry? They carry unconscious proprioceptive touch and pressure sensations from the upper extremity and from upper half of the body. Now at the end, always remember the comparison of these three arcuate fibers. This one is the internal arcuate fibers. It arises from the nucleus gracilis and cuneatus, and terminate in the medial lemniscus, and it carries the proprioceptive sensations of the discriminative touch, vibratory sense, and conscious muscle joint sensations. Then anterior external arcuate fibers, they arises from the arcuate nuclei. They terminate in the cerebellum as circumolivary bundle, and they play a role in relaying sensory information to cerebellum, which is crucial for coordinated movement and balance. Then posterior external arcuate fibers, they arises from the accessory cunate nucleus. They terminate as cunocerebellar tract in cerebellum, and they carries the unconscious proprioceptive touch pressure sensations from upper extremity and from upper half of the body. So this was all about the arcuate fibers in neuroanatomy or in the medulla oblongata.